I understand that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan University students. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
Brian is a 32-year-old Caucasian male who drives himself to the emergency department. His main complaints are hypertension, headache, intermittent blurred vision, and numbness and tingling to his face. Brian is alert and orient times 4. Speech is clear and appropriate. Upon triage, his vital signs are the following. He is afebrile. His heart rate is 93. His blood pressure is 210 over 112. Oxygen is 97% on room air, and his respiration is at a rate of 14. An EKG is completed before Brian is placed in a room and shows normal sinus rhythm. An eye exam is also completed using the Snellen chart, which shows 20/20 vision bilaterally, in which no corrective lenses or contacts were worn. Brian ambulates to the exam room with a steady gait. Hello, my name is Megan. I'm going to be the nurse taking care of you today.
Hello.
Is it okay if we kind of talk about some medical history before we talk about what brings you in today?
Sure.
Okay. So do you have any allergies at all?
I do not.
Okay. And then any previous medical history?
I have bad sinuses, but other than that, not anything I've been told of.
Okay. Any surgeries in the past?
I've had my tonsils removed and my appendix.
Okay. And then are you on any medications that you take daily?
I take Zyrtec.
Okay, just for allergies?
Yeah.
All right. Tell me what brings you in today.
I've been having a headache for the past several weeks and just not feeling like myself. The past 2 days, the headache is the worst it's ever been. Stress in my life definitely doesn't help and always seems to make the pain worse. I also am concerned because I checked my blood pressure today and it was in the 200s. I was told a long time ago at a clinic that I am at risk for high blood pressure, but I've never actually had it before.
Okay. Can you point to exactly where your headache is?
Mainly just the frontal region and around my eyes.
Okay. Is the headache constant or does it come and go?
It's constant, but it goes from sharp to dull intermittently.
Okay. And I was just kind of reviewing the triage note before you came back to the room. I saw that you had mentioned blurred vision. Can you kind of tell me a little bit about that and when all it began?
It started a couple days ago, and it just comes and goes. It's really been frustrating because I'm a worship pastor and can't really concentrate on the computer when I'm preparing PowerPoints for our songs. It's also really hard to play guitar and sing when my head is pounding all the time. I'm just ready to feel better again.
I'm sorry. I know that's frustrating. I'm glad you're here, though, to be seen today, because it sounds like you do definitely need to be seen and evaluated. Have you had the chance to talk to anyone at the church about kind of your frustrations?
Yeah, my worship team and pastor have been very supportive, and they're the ones that actually mentioned that I should come today.
Okay. We also have a great staff of social workers. If you like, they're great listeners. They could always come by and kind of talk to you. Sometimes they're good at just giving resources, coping skills when stress comes, and just different things. If you like to, that's definitely an option.
Well, I'm glad to have that option. I may ask you about that later after I figure out what is going to happen.
Okay, no problem. If they can be any assistance, just let me know. Are there any other symptoms that you're having?
Other than what I've mentioned, the only other thing I can think of is I just feel very tired, and sometimes I've had some numbness and tingling on the left side of my face.
Okay.
It started a couple days ago, and it comes and goes as well.
Okay. I'm going to go ahead and perform just my assessment on you, if that's all right with you.
Okay.
So what it entails is first I'm going to take a listen to your heart and then your lungs. And then I'm just going to complete a full neurological assessment. Since your blood pressure is high, you're having a little bit of that tingling to the left side of the face. It sounds like it's been going on for a couple of days, but we just want to check everything out. Is that okay with you?
Yeah, that's fine.
Okay, and if you have any questions as we go, just let me know. So what I'm going to do is I'm going to listen to your heart first so you can just breathe normally. Okay, your heart sounds great. So now I'm just going to listen to your lungs. Take a big deep breath for me. Okay, another big deep breath. And put this underneath your arm. Big deep breath. This side. Are you able to sit up a little bit for me?
Yeah.
Okay, more big deep breaths. Do you feel short of breath or have any chest pain when you do that at all?
Not really.
Okay. So now we're going to move on to the neurological exam. So I'm just going to ask you a couple questions.
Okay.
Tell me what your name is.
My name is Brian.
Okay. And then what's your date of birth?
August 28th.
Okay. And then where are we at right now?
We are at the hospital.
Okay. Awesome. You passed with flying colors.
All right.
Can you do me a favor? Can you close your eyes real tight for me? Okay. Open them up. And then squeeze your hands like this and then let go. Perfect. Okay. So I'm going to have you squeeze my hands as hard as you can and then pull me towards you. Okay? And push me away. Perfect. I'm going to use my light right here just to check out your pupils. So I'm going to have you look straight ahead. You're going to get a bright light in front of you, okay? Perfect. Okay. And then can you see this pen? I'm going to have you follow it with your eyes. Hold your head straight and just follow it. Perfect. Okay. So now what I'm going to have you do is I'm going to have you hold your right like this and then just hold it up. Okay? Keep hold. Okay, I'm going to push and you try to resist me. And then I'm going to have you push back as hard as you can. Perfect. And then hold this arm up. Okay? I'm going to push and then you try to push down. Okay, perfect. Can you hold this leg up for me? Okay, keep holding it. I'm going to push, and then you try to push down. Perfect. And then same with this. I keep holding up. I'm going to push, and you try to push against me. Okay, great. Your strength is really, really well. So what I'm going to have you do now is I'm going to have you put your finger on your nose, and then you're going to put it on my finger, and then you're going to go back and forth, okay? Okay, can you try it with the other finger, your other hand? Perfect, okay. And then I'm gonna touch your face on one side, and you're just gonna tell me if it feels the same on both sides, okay? So this and this, does it feel the same at all?
Yeah.
Okay, what about this and this?
Yeah.
Okay, and what about this and this?
Same.
Okay, sounds good. Well, it looks like we already got an EKG. I just kind of did that neurological exam. We will want to recheck your blood pressure just because it was in the 200s when you first got here.
Okay.
So we'll definitely do that, and then we'll have the doctor come in and talk to you, okay?
All right.
Any questions at all?
Not right now.
All right, thanks so much.
Thank you.